are central to health promotion and well-being. We really cannot be successful at our health promotion activities or health promotion interventions and programs if we're not addressing the core and fundamental needs of people to be nourished and to be to meet the kind of basic demands of life, which would certainly involve adequate nutrition. And we've already discussed in previous analyses that that I've done that when you're not getting adequate nutrition early on in life, you're likely to be stunted or otherwise malnourished, which is going to result in cognitive functioning. And so when you talk about the social gradient, and people that are lower on the social gradient, are they less likely to get access to and be able to purchase foods, healthy foods? And the reality is that they probably are not. So this is really interesting, and what this shows here is that these are the types of stores where people are most likely to well, so what you're seeing here is a distribution, of stores in, and this is a comparison of Grand Rapids, Michigan, and New Orleans, Louisiana. And what's interesting is that most consumer dollars in Grand Rapids, Michigan, go to grocery stores, while only 20% of these in Louisiana go to grocery stores. So probably what's happening is that in Grand Rapids, Michigan, where there's going to generally be, and there's a racial difference here. So in Grand Rapids, Michigan, there's going to be a lower percentage of African Americans. Most of them are purchasing food in grocery stores, whereas in Louisiana, fewer are purchasing food in grocery stores. So where might they be going? They might be going to dollar stores, to convenience stores. Large stores, Costco, large grocery stores are more likely to sell to whites, while Hispanics are more likely to shop and purchase food at dollar stores, drugstores. So you make comparisons about what types of foods are available at those different types of stores. Fresh fruits and vegetables are less likely to be found at in a drugstore or in a convenience store or at a dollar store. And you look at the countries where the prevalence of undernourishment is higher. Latin American countries, Asian countries, sub-Saharan African countries. And of course, those would be very related to economics. Mortality from coronary heart disease in relation to fruit and vegetable supply in selected countries. So if the supply of fruit and vegetables is high, meaning if they are available or in greater quantity, your risk for coronary heart disease is decreased. Now it's interesting because this is on a population level. We're not asking individuals. We're just looking at this kind of ecological comparison of, in our country, this is available, and look, coronary heart disease is much lower. Now, lastly is this idea of transportation, and this probably relates to infrastructure. And Michael Marmot would make the case that if you are lower on the socioeconomic ladder or the social gradient, you're less likely to have your own car, which means you're going to be more dependent on public transportation to get around. And if the city or the state or the country as a whole doesn't have a very strong public transportation infrastructure, you're not going to be able to live on one side of the community and take advantage of employment on the other, because it will either cost you too much in terms of the time for travel, or maybe even in the amount of money. So when I lived in San Diego, I decided that I wanted to ride the bus from my home in La Jolla to where I worked. It was a distance of about 10 miles, and it was further inland where I worked. And so I got on the internet and I put in the terminal location of my job and my starting location of my home. And what I quickly determined was that it would take me almost 2 hours to get to work and even longer than that to get home. And there were about 4 bus transfers. And so um, at a minimum, that would have been 4 hours transportation. And so if I'm lower on the socioeconomic ladder or even higher, it doesn't matter, that's just not a viable solution for me. And so if I want to live in an area that I can afford because I'm lower on the social gradient, but I also want to take advantage of employment that might be available in another place where the rent is higher, if we don't have public transportation, I can't do that. Also, there's an obvious benefit, and that is that public transportation means there's less driving, and implicitly we're walking more and we're biking more. So you have to walk to the bus stop, and from the bus stop you walk to your job, or you walk to the grocery store or something. And so transportation in general results in public transportation, that is, results in a better health outcome for communities. And this is quite interesting that um, there's been a dramatic increase, even in the UK, in personal car transportation. And of course, in the United States, we're very accustomed to traveling in personal automobiles, especially in the western part of the US, where the personal automobile was mainstream well before our communities were constructed. And so now in the U.S., it's very viable for you to live and work with a distance of about 20 miles in between the two. So you can just drive to work, and so we had the proliferation of suburbs, and we invested in road infrastructure more so than public transportation infrastructure.